Hello, this is Charles Bullis for Speak NJ. Our guest today is Bob Luckrich, who is the Director of EMS for the Jersey City Medical Center. Good afternoon, Bob.
Thanks for having me.
Pleasure. The Jersey City Medical Center now is in a crisis mode, I guess, because of a plan by the City of Jersey City to actually take on a new EMS provider, and it's not you guys. And so, can you tell us a little bit about why that's come about, what's happened, what your take on it is?
Well, certainly. There is certainly a lot of concern here at the medical center with the direction that the city's indicated that it's going to go in terms of the EMS provider. As you probably know, we've been the city's EMS provider for over 130 years, since the days of horse-drawn ambulances. We're one of the oldest EMS agencies in the nation, and it's something that we've been providing consistently. And we believe that we provide some of the highest quality EMS services, some of the highest quality care, and we have the data to prove it. And we certainly have some concerns as to what the implications are of a potential change on the residents of Jersey City.
Yeah, I mean, you guys are considered one of the best in the United States. Why are you so successful?
Well, I think there's a couple different things. As you probably know, when you look at the history of the medical center, we've had our ups and downs over the years. We had some significant financial losses, particularly after we spun off from the city back in 1988 and became a nonprofit. And we've worked really hard to kind of figure out how it is that we can get the entire hospital back on its feet. And for us in EMS, that's really forced us to really take a close look at everything we do. Because like the rest of the medical center, over the past 5 to 7 years, we've really been trying to make sure that we can be as efficient as possible, making sure that we can reduce the overhead and the costs associated with EMS, and making sure that we invest in technology so that we can do those kind of things. And it's led us to really be a data-driven organization. And that's, I think, the key, is everything we do is about data. We don't just go out and do things because it's the way it's always been done, or because it's the way we think things should be done. We do things because the data proves it.
And I think you guys have a state-of-the-art facility here where you dispatch ambulances from and so on. We just took a quick tour of it. But explain a little bit about the state-of-the-art facility that you do have in there and why it's so important.
Sure. Back in 2006, we were trying to find ways we could be more efficient. That was the year that the medical center lost about $66 million. And so for us, again, it was how can we be more efficient? And we invested in a new technology that we call our Marvelous system, that I'm sure you've heard about, that actually is a predictive model that is able to use computer algorithms and historical call data to actually predict where it is that the next emergency is most likely to occur. And then we use that to move our ambulances all day long, depending on where it is that the computer system is predicting where the call is going to occur.
Right. So that explains, for instance, why people would see ambulances in different locations around the city, oftentimes think they're just hanging out, but they're not really. Mm-hmm. They're there because this is considered a hot spot and something's liable to happen. You guys are prepared to act.
Right, yeah. We have 14 different locations around the city that are usually, associated with somewhere where, the crews can use restrooms and facilities and things like that. And we move the ambulances depending on where it is, time of day, day of week, and season, based on where it is that we think the next call is going to occur. It's interesting, when we looked at this system, the reality is that people move. Unlike a fire department that's fighting fires in buildings that don't move, people move, and people are creatures of habit. And that's what the system told us, is that we can move our ambulances to where they're needed the most. And using this system has been so effective for us. We've been able to reduce our response times by more than 3 minutes. We have an average response time of under 6 minutes for our calls in Jersey City. And we've been able to increase resuscitation rates, which means more people are getting to the hospital alive and more people are getting discharged alive. And that's something that really you can't put a price tag on.
Explain a little bit, you guys are, when I say you guys, I don't mean to say it that way, but the Jersey City EMS has an advanced life support rating, system. And I understand that the competitor that's being looked at is not qualified for the advanced life support system. And they only provide basic life support, or BLS.
Yes.
What is the difference between those two,
Sure.
essentially?
Just to kind of make you understand a little bit better here, there's 2 levels of EMS. There's basic life support, which is what this contract is for, which is uses EMTs. They have about 250 hours worth of training. They do transport patients to the hospital. They do backboarding, defibrillation, oxygen administration, and some other basic level emergency skills. The advanced life support, which is what you're referring to, is the paramedics, and that's a much higher level. Those are actually, we call them mobile intensive care units, and they really are an opportunity for us to bring the emergency room to the patient. The paramedics go through 1,000 hours worth of training. Here in Hudson County, we put all of our paramedics that go through our paramedic program graduate with a degree in paramedic science. They can start IV lines, put breathing tubes in. They carry over 42 different life-saving medications. And really, they truly are a mobile emergency room. So that's the two different levels. In terms of this contract, the contract is for the basic life support services. The advanced life support service is done through a certificate of need process through the State Department of Health. So we actually hold the certificate of need for all of Hudson County east of the Hackensack River. And so we are the state designated advanced life support provider. But what this means for Jersey City in terms of kind of, how does this play in is that we truly are an integrated system here. Every step along the way and every level of care is provided by the Jersey City Medical Center. From the moment you dial 911 and one of our advanced emergency medical dispatchers who answer the phone in our dispatch center, which is the only accredited dispatch center in Hudson County, they start off, they're able to give life-saving instructions, tell people how to do CPR. They can even tell people how to deliver a baby, which is something that actually happened last week. And we are able to, from that point on, all the way through the ambulance arriving, all the way through the paramedics, and all the way through the emergency room, we can track that, and we can do quality improvement on the whole continuum of care. And we think that's really important. And that's why we've really invested in making sure that we have not only an adequate number of basic life supports, but that we're able to add additional paramedics onto the streets. And we're able to use creative models to make sure that we get as many paramedics out in the street, as many EMTs out in the street, to be able to respond to these kind of emergencies.
You had mentioned earlier about an instance this morning where a young man was shot in the center part of the city, and your response time was just a little over 3 minutes.
Yes.
And I guess we can credit that to the fact that you guys had ambulances nearby.
Yes, exactly.
Right. So that's important for people to understand that.
Yeah, it always amazes me, when I go back and whenever there's something that we're going back and doing some quality improvement, the response times here are unparalleled anywhere else in the country, and certainly in a city like Jersey City where you've got the congestion and the traffic. As you were saying today, at 8 o'clock this morning we had that incident, and that's right in the height of rush hour. We were still able to get an ambulance on scene in 3 minutes and 27 seconds.
That makes it even more extraordinary.
Yeah, we're very, very proud of that.
Yeah. Let me ask you, recently the city had, I guess, formed a committee to evaluate both you, the Jersey City EMS, and your competitor, which is McCabe, and determine their performance levels and so forth. Can you tell us why there might not have been any physicians or EMT representatives on the review committee to choose this ambulance service?
I can't speak to that. Something you'd have to ask the city in terms of how it is that they made the decision as to.
But it's a little puzzle as to why there wouldn't be, because it seems they would want to come to someone who has the expertise.
For us, it certainly is interesting, and I won't speak necessarily to the composition, but I think one of the things that's been a real challenge for us is the weighting of the criteria in terms of quality versus finance. And for us, I think if you look at it and you look at the scores, in terms of quality, we beat out our competitor in every single area, and we're very proud of that, and we know that we truly are one of the best EMS agencies in the country. So for us, when you look at kind of whether or not what kind of people they put onto this committee, I think that certainly is a question in terms of are we weighting quality? Are we really focusing in on the healthcare and what's best for the lives of the patients?
So you're not essentially aware of the criteria that the city might have set forth in the contract, are you?
Well, in terms of what?
In terms of performance and so forth,
Well, there's different performance criteria that are specified in the contract that we have to meet, and that we've been doing that for many years. We've been receiving the subsidy from the city since 2006. So we do have to maintain certain levels of response times. Like I said, our average response time is just under 6 minutes right now, but we are contractually obligated by the city to respond to 90% of our calls within 7 minutes and 59 seconds. So we do have those types of things. We do provide reports to the city in terms of performance.
Well, another interesting point is that your competitor, the McCabe system, is part of the CarePoint system, which bought and merged with Bayonne Hospital, Christ Hospital, and the Hoboken University Hospital. Bayonne Hospital has been cited as the country's most expensive facility because it's a for-profit facility. Do you believe that ambulance services would rise under your competitor?
Certainly, when you look at the healthcare marketplace in Hudson County, I truly believe that the public needs to take a real close look at what's going on. Jersey City Medical Center is the last not-for-profit hospital in Hudson County, or in central Hudson County, with the exception of Palisades up on the Bergen County line. And we really truly are out there for the patients. One of the unique things about Jersey City Medical Center is twofold. We are a hospital that really focuses in on doing what's right for the community. We truly are a community-oriented facility. We still have board representation from the city on our board of trustees. And we've always tried to do what's right for Jersey City, focusing in on things like providing an adequate amount of charity care. We provide more charity care than every other hospital in Hudson County combined. We have a homeless outreach program. We have the city's first HIV clinic was run through the Jersey City Medical Center. It's one of a very large program that we still run today. But in addition to that, we are your tertiary medical center, meaning that we treat the most sick patients. We're the only level 3 neonatal intensive care unit. We're the only trauma center. We're the only cardiac surgery center here in Hudson County. And so for us, it's really trying to find that balance and making sure that we reinvest the revenue that we get in through our patients into things that we can provide to the community. Last year, when we had to report to the IRS in terms of how much we provided in terms of community benefit, we found that we provided over $28 million in community benefit to the citizens of Jersey City through charity care and subsidies to other programs. And so that really speaks volumes. When you look at kind of what's going on in terms of a transition to a for-profit marketplace, you gotta ask yourself in terms of who's going to care for all of those patients. And one of the concerns that we have is this out-of-network model that's going on in terms of healthcare here in Hudson County. An out-of-network model, meaning that they're not in network with most insurance plans. And the question that we have is, what is the trickle-down effect of that business model on the residents? Because ultimately, we believe that the cost to residents is going to go up, and I think that this EMS truly is going to have a huge impact on the finances of the residents of Jersey City as they see increased healthcare costs. As you said, CarePoint has been recognized in one of their hospitals as the most expensive hospital in America. You're going to see higher bills. You're going to see higher insurance premiums. And we do have some concerns, and that's part of what we're trying to focus in on, is making sure that we're providing adequate care to the residents.
That apparently is a red flag for a lot of people out there, and many people were aware about CarePoint being the most expensive, Bayonne Hospital as an example, being the most expensive in the country long before the issue of the EMS contract came up. So that is a concern for many people, especially in today's economy. What is this care provider going to cost me? Basically, is what they're saying. If I have to go to the hospital, is it going to cost me $1,000 or $2,000 or maybe $6,000? And that's something that people can relate to.
I think you're absolutely right. There needs to be some focus and some concern on what the cost is going to be, and I can't speak specifically to what the costs are going to be for the ambulance trip. But the real concern and what people need to look at is what happens, as that trickles down. What happens after the ambulance trip? What happens when these patients end up admitted to these hospitals and they start, accruing these large bills? Who's paying for that at the end of the day? For us, again, being a not-for-profit hospital, we're in network with almost every single health insurer, and we do that, because we think that that's what's right for the community. We do that because we want to make sure that we're adequately caring, for the residents, and that we're keeping residents and visitors' best interest in mind.
So what then, as this approaches a council meeting is coming up, I believe, next week, I think it's on the 16th, what is it that the people in the community can do if they're concerned? What can they do to help you guys or gain more information about this issue?
There's certainly, one of the things that has absolutely been really humbling for us is the outpouring of community support. When this was first put on the agenda last month, we immediately got calls from members of the community that were very concerned about the implications of changing EMS providers. And for us, we think that's really had an effect. to have all of this outpouring of support is really, really humbling, and it's a real great thing. The important thing for people to do is to educate themselves and reach out to their elected officials. We need to get the message across to the council, to the mayor, that this is a really important issue. This isn't a simple contract that, like some of the other contracts that you might see in the city. No, this is people's lives that are at stake. And it's important that we really take a close look at what's going on here. We take a real close look at what the outcome is going to be and what the long-term implications are. It's essential that we really take the time and slow down and kind of figure out, were there problems along the way? Do we need to reevaluate the process? And making sure that residents get to their elected officials and let them know that they want to see a little bit more.
And even more important, I think it's very important that people understand that with that meeting coming up next week at City Hall, it's going to be in the council chambers, and it's possible that a vote will be taken on it on that night, that all citizens who are concerned about this issue make it their business to be there. I believe they start at 6 o'clock at night, and I believe the date is going to be January the 16th. So make it a point to be there. And certainly, another comment would be that, Bob, you guys are sitting here in the midst of a tremendous amount of growth going on in Jersey City with much more planned. For instance, 80-story towers up at Gerald Square, and many more people, maybe several thousand people coming into that complex alone. So the need to have a state-of-the-art, top-notch facility to handle all this and be prepared is something I think you guys have already planned for and are in mode to do. And so going with an unknown factor at this point seems kind of risky.
I agree.
So I want to thank you, Bob. Bob Luckritz, who was the director of the Jersey City EMS here at the Jersey City Medical Center, for being our guest today. And in a moment or two, maybe we'll take a little walk inside the dispatch center and show you how all this works. Thank you again. I'm here with Bob Luckritz. We're in the EMS dispatch center. It's called the Hudson, correct?
Yes.
Bob, and we're looking here at what is this called, Bob, this screen?
This is called our First Watch system.
First Watch system. Explain about it. Yeah,
sure. We're actually the first in the state to implement this system, and what it is actually a real-time, we call biosurveillance tool. What that means is it is looking at real time at every single 911 call that we process through our dispatch center here at the medical center. And it's evaluating all of the different components to a call, looking for trends that might indicate some sort of a problem in the community. So this was actually developed shortly after 9/11 to look for potential terrorism, bioterrorism. And so it's looking for things like spikes in the number of people having difficulty breathing or with stomach problems or patients that go into cardiac arrest. And it's seeing if there's an abnormal number of these occurring within a short period of time or an abnormal number of these occurring within a short proximity to one another. And it's able to look at these in real time as we're screening the calls. And if it sees a problem, it can then send out an alert to everyone that's in the system, which would be all of the administrators in EMS, and allow us to drill down and examine each one of these calls, and then notify the appropriate authorities if we find something.
With the possibility that something of a large scale in nature, possibly terrorism or something like that is happening.
Right, so for example, if someone were to come out of, say, the PATH train, and there were a large number of people that are having difficulty breathing, it would send us an alert, and we could look into that and then notify the authorities that we think there's a problem. And this way, we can actually prevent additional problems from occurring. So if we know something like this is occurring, we can prevent secondary injuries from first responders that are going into these types of emergencies.
So now, as we pan around the room, we see individual dispatchers at work. Explain to us what happens when they get a call. What exactly do they do?
Sure. Well, there's a couple of different things that we do here. When they receive a 911 call, they obviously immediately start screening the call. We use a system we call ProQA, which allows us to screen the 911 calls in terms of determining what types of emergencies they are, what level of resources they need. We're actually the only nationally accredited dispatch center in Hudson County, and we got that through using this technology that we have here. Based on what the criteria is that comes in, we then immediately send the appropriate level of ambulance to the call.
What is the most common call you get here in the dispatch center?
There's certainly, there's a wide variety of calls. This is Jersey City. It's quite a diverse community, and we see an equally diverse number of calls. I'll tell you, one of the most common calls that we actually get is, motor vehicle accidents and pedestrians that have been involved. With such a walkable city that we have here, it's actually, a disproportionately high number compared to other cities.
And how do these different shadings on the screens, what exactly do they indicate? The purple as opposed to red and gold and green?
Sure. This system that's up on the screen here is actually our Marvelous system, and that's a system that we use to predict where does the next call is going to occur. That's a system we developed back in 2006. I talked to you about this before, but it actually is able to look at historical call demand and make a prediction based on time of day of week, and season as to where the next call is most likely to occur. And then we move the ambulances all day long depending on where the model is predicting. So on any any given day, we're moving the ambulances based on the model. It refreshes every 30 seconds and allows us to make sure that the ambulances are where it is that they're needed most.
And about how many dispatches are on call at any given time here in the center?
Just like our ambulances, I mentioned before, we really focus on efficiency here. And so one of the things that, back when we were trying to work, financially back in 2006 and how it is we could be a little more efficient. In addition to looking at moving the ambulances around, we actually went to we call a dynamic model of deploying ambulances during the day. So it varies depending on time of day and day of week as to how many ambulances we have and how many dispatchers we have. So we could have anywhere from 3 to 5 dispatchers depending on time of day.
314 is going on a personal.
Okay, well, that sounds great, Bob. It's really very impressive, and thank you again
Thank you
for
very
showing
much.
us this control center.